Welcome once again, African Motion. We are continuing with part 2 on this topic of malaria. We have seen part 1, the definition, the causes, mode of transmission. Today we are going to see the consequences, complications of malaria. How is malaria treated and prevented? Now, let's start on the complications of malaria and the consequences that it comes with. 1. Anemia, dehydration, splenomegaly, hypoglycemia, kidney failure, and seizures. What is anemia? It's a shortage of blood because malaria does destroy blood. Dehydration, the patient will be dehydrated because it is destroying blood, and the fever itself and the sweating that we saw in the previous part will cause the dehydration. Splenomegaly, the blood that are destroyed will go and get stored in the spleen and it gets swollen. Hypoglycemia, as the body is fighting, a lot of work is being done by cells, there is a fight going on, then it causes hypoglycemia. Kidney failure, the kidneys will fail as they will be having a lot of debris from the destruction of what? Red blood cells. Seizures and cerebral malaria will cause edema in the brain. Now, when you check the anemia, because of massive red blood cell destruction, you can see the two hands. This hand is not looking well. This is pink, but this one, it's white. There is no blood because of what? The red blood cells destruction. Another thing is what we call cerebral malaria. Once the malaria have been affecting the brain, what's going to happen? There will be leaking of vessels. You can see the vessels are fine, normal here, but now when they start leak, they will cause water to be full in the brain, then to cause what we call cerebral malaria. You can be mistaken with meningitis or encephalitis. Then you start giving treatment for meningitis while it is malaria. See, this is a normal brain with normal structures, but here it's edema and the brain is being compressed by what? By that edema. It does affect mothers and their babies. Remember, if the blood is being destroyed, and remember that the blood that mother has is the same blood that she gives to the baby. So both of them, mother and baby, will get a shortage of blood. We know all the complications that will happen. Eventually, the malaria might cause death to both of them. Lung involvement. It was documented that 200 years ago, lung involvement is one of the complications that we can write down as one of common complications. Why? It does cause edema as well in the lungs. Then, end of the day, it will cause what we call ARDS, which is acute respiratory distress syndrome. Another thing is that with this edema, the vessels will be what? Will be leaking. The water will be coming out of the vessels, including the soldiers of the body, yes, coming to fight to see what's going on, and the edema will cause image like this on X-ray. We don't see white areas on X-ray on a normal chest X-ray. Everywhere it should be black, but once becoming edematous, then becomes white like this. Respiration will be a problem. The same way on the kidneys. You see the leaking of water coming outside the vessels and causes edema. And not only that, the debris though that we spoke about of red blood cells will come and block this filter. This is a filter in the kidney. This is the kidney with the filters which will be removing all the toxins, and the toxins should be coming all this way in the calyces, coming in the ureters, then in the urine. Once this filter is blocked, it can cause what we call acute kidney injury or renal failure. Not only that, with destruction, a chronic malaria, it will cause the swelling of what? The spleen and the liver. Normally, these organs, you cannot palpate them. You don't feel them when you palpate on the abdomen. Even spleen, but once it starts swelling, they become hard and you can feel them. Sometimes it can swell until it crosses even umbilicus. You can see it has really grown up to the point where it moves from behind the stomach, then it reaches this area. Sometimes it can grow to the point where it will be 10 times the weight it's supposed to have. A normal spleen normally is 150 grams and it is around 11 centimeters long. You can see it is posterior to the stomach, but now when it grows bigger, it can reach 1 kilogram. So, the most feared complication of malaria is death. Why? It kills. It's a killer. You can see in just 1 year, 2018, it has killed 405,000. And people who are infected with this malaria parasites worldwide, 228 million. This is too high. It's too much. You know, we need to do something about it. How do we treat this malaria and how do we prevent it? World Health Organization is doing a lot to make sure that this condition, this malaria, is controlled. They are trying a vaccine now, where in 2019, Ghana, Malawi, and Kenya rolled out for the first trial of this malaria vaccine. It's a pilot program. We believe it is going to produce a good outcome where the vaccine will be made available to people so that we can overcome this big challenge that have been existing for centuries now. So the first malaria vaccine in Africa is going to be a potential new tool for the children health and improve malaria control. Malaria is a preventable disease. It is treatable. So the primary objective for treatment is to ensure the complete cure. We don't advise people to cut treatment once they have started, because to have resistance is not good as well. So the rapid and full elimination of the Plasmodium falciparum, the parasite, from the patient's blood is the highest objective to follow. From the public health perspective, treatment is meant to reduce transmission of the infection to others. By doing what? By reducing infection from the reservoir. Where the reservoir is, it should be eliminated. And by preventing the emergency and spread of resistance to anti-malaria medicine. The medication that are available already, we wish them to remain active. We don't wish to get resistance where they become useless. That's why people should take medication and continue and finish the full course. Some of the medication given, they are like artemisinin, amodiaquine, chloroquine, primaquine, fancida, and quinine. Quinine is the biggest one among these ones because complicated malaria, quinine do very well. And when it is very complicated, you don't go for tablets, you can go straight IV. You put in the drip, but healthcare worker, please remember to put quinine in dextrose, in the sugar drip, because if you don't do that, it can cause hypoglycemia, a serious complication as well. There are other measures that can be put in place using mosquito repellents, indoor residual spraying, and preventive drugs. People who are going to travel, moving from free malaria areas, if they go to endemic areas, they need to have those tablets which are for prevention. Another way of preventing is to clean the environment. Make sure that you don't have rubbish around your houses. Make sure that nothing is around your house, such as these tires and buckets and pots, where it will look like you are farming mosquitoes. Very important to clean environment. We should not give chance to these mosquitoes, which will produce malaria to everyone in the house, particularly children. The mosquito nets are very important because they will be protecting the accessibility of the mosquito to anyone who is sleeping at night. The mosquito might be impregnated with what? Insecticide. And the mosquito, when it comes, it will die or it will run away. So, good people who are staying in the endemic region, in the red zone, is it okay if we come together and try to analyze the causes and try as well to listen to those who did researches before, to World Health Organization, and listen to the advices they are giving us, try to overcome. Dear people who are in the green zone, may you please come on board, try your best and make a difference in lives of people who are suffering in this area. I believe in the unity. There is a saying that says, united we stand, divided we fall. I believe in unity. Let's come together. Thank you very much. Health education, health promotion will continue to be our song. Let's move together. Thank you very much.